Thanks to advances in genetic analysis and to cheaper whole genome sequencing, fresh tissue sampling is set to be the standard of care in cancer treatment. Here, Dr. Claire Verrill explains which cases are best to sample fresh and how to ensure that diagnostics are not compromised when using fresh frozen material.
We have adopted fresh frozen tumour sampling from prostate cases for the 100,000 Genomes project. It's a method we've been using for the last 4 or 5 years, and we find it's a robust way of sampling tumour and getting successful samples with 40% tumour content without disrupting the capsule, so without disrupting staging of the prostate cancer and without disrupting the margins, so we find it works really well. Previously, we have tried formalin-fixed paraffin-embedded samples for whole genome sequencing, and the quality really wasn't optimal. So for the best sequencing results possible, we need fresh frozen material. The challenges with sampling prostates fresh and getting the fresh frozen material is obviously making sure the diagnostics aren't compromised. For example, getting the slice out of the prostate with all the margins intact is incredibly challenging. The other thing is getting a successful tumour sample, but I find that we can increase our success rates by selecting the cases carefully, so we won't try every case, we'll pre-select them so to make sure there's enough tumour on the biopsy that we're predicting a fairly large tumour. The advantages of this fresh frozen sampling method are that we are obtaining fresh frozen DNA for patients for whole genome sequencing, so it's all about the DNA quality. By having the fresh frozen material, you get much better quality nucleic acids, so the types of mutations and genomic changes can be called much more accurately than can be called on formalin-fixed paraffin-embedded material. Going forwards, these results will come back in a timeframe which means that results can be actioned and patients can be treated as personalised medicine effectively for the particular genome of their tumour. If we couldn't find tumour in the H&E blocks, I would do the usual things, go back and revisit the biopsy and make sure the diagnosis was correct, but ultimately I would turn to the fresh frozen punches and return them to the diagnostic process and look for the tumour within those. I've been doing this method for 5 years and we haven't yet had a case where we haven't had tumour in the diagnostic blocks. One case with fresh frozen sampling from a prostate takes about 30 minutes by the time you've received it, inked it and done all the pinning out afterwards to make sure that the margins are pinned nicely and the diagnostics are not compromised. We don't need any specific equipment for this method, that's the beauty of it. So long as you have a sharp knife, some inks and a cutting guide plate, and most histopathology laboratories have those, it just needs to be able to cut a slice about 4 or 5 millimetres thick. You can conduct this method, so no specific equipment required. The surgeons really didn't take much persuasion at all to send the samples fresh. They're very keen on research and doing the best for patients, and they recognise that getting this fresh material for whole genome sequencing is going to be one of the best things we can do for those patients, so they're totally on board with it. Before I buy a bank of prostate, I check the patient's biopsy report to make sure that there's adequate tumour in there for me to be able to take fresh samples without compromising the diagnostics. So I'll generally make sure that there's at least one biopsy with more than 1 millimetre of tumour in before I'll attempt to sample the case. I pre-screen cases before I sample them, so I don't just receive every case fresh. So I'm looking for having adequate tumour on the biopsies. That's more than one biopsy with more than 1 millimetre of tumour. And then generally I tend not to do the prostates that are more than 100 grams because they have prominent hyperplasia and they bulge when you cut into them. I don't have a lower limit for a weight that I'll sample at. So then we receive the specimen fresh from theatres on ice. I will look at the external capsule of the specimen and make sure there are no significant breaches, and then I possibly may not do the case if there are. I'll look for staples and sutures on the capsule, and again, just on a case-by-case basis, I may or may not sample the case if it has those in there. And if I'm happy to go on, I will ink the case. So we ink the right side blue, the left side black, so that we can identify the laterality. And then I put a strip of yellow ink on the anterior surface in case of problems with orientating the specimen later on, although you should be able to work out anterior from posterior from the shape of the urethra. And also I put green ink on the base, which is the irregular area where the bladder would have sat, and that's an area you can only identify macroscopically. You lose that microscopically. I will then pop the specimen down and remove the apex about 1 centimetre superior to the apex, pop that main bulk of the prostate onto a cutting guides plate and cut a 4 to 5 millimetre thick slice. The slice needs to have the margin, the inked margin, all around the outside so you don't compromise the margins. And I will then take 9 punches using a 5 millimetre dermatology punch tool from the slice, being careful not to go near the capsule to compromise staging of the prostate. In particular, you're looking not to compromise the assessment of extraprostatic extension. Those punches are snap frozen in liquid nitrogen. I pop red ink in the punch holes to denote them from artefact that you sometimes get when you're cutting the slice. The specimen is pinned onto corkboard so that the inked margin, which sometimes has retracted, is not artefactually compromised, so we pin it back down to the corkboard. We then take the pinned prostate pieces and pop them into formalin, so we flip the cork over so the prostate's within the formalin, and pop some paper towels over the top to stop the cork flipping up and the specimen not being in the formalin. So then it's fixed overnight, and then I will come back and complete the cut-up of the specimen the next day. The fresh frozen punches will have been taken away by a member of the biobank team and processed for DNA extraction and whole genome sequencing. The most tricky part, without a doubt, is getting a complete slice from the prostate to do the sampling from. So over the years I've learnt a couple of techniques to help. So it's quite good to put a little nick in the posterior surface before you then make your main cut from anterior to posterior, so that your slice effectively joins up. Because the main risk is tearing the capsule on the posterior part. So if you make that little nick, you can then join your slice up and not make the tear. And also when you get towards the last bit of making the slice on the posterior aspect, you can sometimes use scissors to cut the last bit, again to avoid ripping the capsule and making sure that that inked margin is still there. We started sampling prostates in this way in 2012, and initially I was worried that we would damage the margins of the specimen or compromise the assessment of extraprostatic extension by effectively putting punches through the capsule of the prostate. But with time and skill, you just find that you can avoid those problems. And yeah, I'm happy that we've got a method of getting fresh tissue out of prostates that really does not compromise the diagnostics.